Other special guests include two famous personalities living with diabetes. One a professional boxer and the other founder and director of an NGO called Swikiri. Other experts include a public health medicine registrar from Wits University, a nutritionist, a biokineticist, and a diabetes nurse educator. So sit back, relax, and learn from this bumper show ahead. You can be part of this show by calling us with the questions or views on Johannesburg 714-6843, 6847, or 6857. Or interact with us on our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk. I'm Dr. Silomudo, and this is Health Talk. All right, so let's understand a little more about diabetes from our experts. We have with us in studio Dr. Relebohile Ncha. Dr. Ncha is a public health medicine registrar based at the Charlotte Maxeke Johannesburg Academic Hospital, Wits University. Welcome to Health Talk, Dr. Ncha.
Thank you for having me.
All right, we're talking about a very important subject today, diabetes. Perhaps let's just ask you to help us take us through. We hear there's different forms of diabetes. Mm-hmm. What is diabetes?
All right, so the story of diabetes begins with an organ called the pancreas, which releases a hormone called insulin. Now, insulin assists the body cells to absorb glucose and convert it to energy. Now, in diabetes, there's either no production of insulin at all by the pancreas, or that the insulin is there, but the body cells are not using it effectively.
Right.
Now, that then differentiates the types of diabetes that we have, the two main types, type 1 and type 2. For type 1 is the one where there's no insulin production at all, and type 2 is where you have then the insulin available but the body cells not using it. Now generally type 1 is found mostly in children and young adults, and with type 2 diabetes is found mainly in the older generation and also with an issue of obesity. Yeah,
talk about, one that's found mainly in children and others obviously in adults. We hear that diabetes is diagnosed now more and more in children.
Yes.
But how much of a problem is diabetes in South Africa? I mentioned in my intro that there's 422 million adults living with diabetes. What's the picture like in South Africa?
Currently the prevalence of diabetes in South Africa is at about 9.8%.
Yeah.
But obviously we have variations between provinces and variations between ethnic groups, where we find that Indians and colored populations are more likely to have diabetes. Yeah. And also it affects females more than males. So that's the picture.
So essentially what you're saying, almost 1 out of every 10 adults will have diabetes.
Yes.
This is quite scary.
It is. And the challenging thing also is that now we're seeing more and more children being diagnosed with type 2 diabetes, which is also known as a lifestyle diabetes.
Okay. We're told that, there's this rule of halves, that half the people are walking around not knowing that they in fact have diabetes. Mm-hmm. How can people know that they have diabetes? What are the typical signs and symptoms?
So diabetes is also one of those diseases that sort of hide themselves until it's too late. And the common symptoms that you find is people being very thirsty or passing urine frequently, feeling tired and lethargic, sometimes having sores that take long to heal, as well as maybe eye problems, sudden change in eyesight. Those are the common symptoms that we see in patients with diabetes.
And how is it diagnosed?
Right, so there's two forms of diagnosis that we sort of can make. The first one is the screening part, where we need to really find, as you stated earlier, that a lot of people are walking around not knowing that they have diabetes. Yeah. So the first point is to screen. And with screening, we say that every patient that walks into a healthcare facility must be checked. And it's a very easy test where you do a finger prick. And if you get a measurement that is above 11.1, that's what we call the random glucose level. Right. Then those patients are likely to have diabetes. Then we subject them then for a diagnostic test, which is then the fasting glucose test, whereby a patient needs to have eaten the night before 10 o'clock. And when they come to a healthcare facility in the morning, then we take the blood sample. And the result that is above 7, then that is definitive diagnosis of diabetes.
We say that once you're diabetic for the rest of your life.
Of course.
Is it necessarily a death sentence? What is the natural cause of this disease?
It is not necessarily a death sentence because we've got medication to control it. As you said, you can't stop having diabetes once you're diagnosed with it. So it's a matter of having a lifestyle that's going to assist you to control it. So the medications that are available are very effective, and if taken correctly, because that's the biggest challenge, if taken correctly, you can be able to control your diabetes and at the same time prevent you from getting any sort of complications.
Now, I mean, this is obviously a dreadful disease that no one wants to get. Are there people that are more likely to get diabetes? Who's at risk of developing diabetes, and what causes diabetes? Actually?
Yes. So the biggest risk factor is being overweight, obese, and especially when you have fat around the abdomen, and that is what we call central obesity.
Right.
So that is the biggest risk factor. But also if you live a lifestyle where you're not exercising, you don't watch what you eat, you know, you are at a higher chance of getting diabetes. But also there's a genetic susceptibility as well to diabetes.
Jeez. We always get blamed for choosing the wrong parents, aren't we?
We do.
Okay, all right. Okay, we continue to learn more about the effects and what diabetes is about. Take a look at this.
My mother, my brother, my sister, and we all have type 2 diabetes. Out of 7, I have 2 uncles left because of diabetes. My mom had me when she was 39. She passed away when she was 53 years old. It was horrible with her. Like, I've seen it all, as far as the leg being amputated, to strokes, to everything. So I know how hard and how much being diabetic can ruin your life. We struggle, me, my brother, and my sister, we struggle taking care of our diabetes. So, I mean, I have to do it, especially for my kids. Like, it's important. I don't want them to see me the way I saw my mom. I literally changed her diapers, laying on her bed, you know, and everything. Like, I refuse to go there. I don't want them to see me like that.
So not acting now is ridiculous. We can see already now that the big insurance companies see that there is a real dilemma coming up, that if we don't make a change, we cannot actually pay anymore our illness.
When you say there's nothing bigger in the world than diabetes,
I mean, the financial implications, the costs involved are so great, and it's a completely preventable disease.
Bigger than AIDS, bigger than malaria, bigger than cancer.
It dwarfs all of them. That's because it is the single one that is going to cost so much for us and really threatens Western civilization. So I don't know what happens when you bankrupt the United States of America, which is going to happen within 10 years. I don't know what the implications are for the future of the world. I don't know what the implications are for every country, and this country too will run out of money for its medical services before 2026. What do you do then when we have to restrict access to medicine profoundly because we just simply can't treat all these obese diabetics?
Well, we know all about the techniques, the solutions, the toolboxes, everything is there. We just have to implement it. We just have to bring it into action.
I think that there is light at the end of the tunnel. I think that we can do it through collective action. I think government, industry, faith institutions, and educational institutions, even our financial institutions, have to be speaking the same language and have the same goal, and that is to create an environment where people can take the time, be with their families, still be successful, and redefine what success is. Good quality of life all around. And I think that we can do it.
I'm sure we can do it. We can beat this diabetes. Now, we welcome a very special guest, Madam Bongi-Ngema Zuma. Now, Madam Bongi-Ngema Zuma is founder of the Bongi-Ngema Zuma Foundation. Most of you would know her as the First Lady of South Africa. But as I said, she's founder and patron of the BZN Foundation. Now, this is an NPO that promotes diabetes awareness and prevention. Now, Madam Ngema Zuma has received many accolades for her work. Recently, she was invited by the Jarvis Christian College in Texas, in the USA, to speak at its annual Black History celebration. She will tell us more about it. Madam Zuma, welcome to Health Talk once again.
Thank you.
All right. Perhaps let's start off by asking you about your foundation, the Bongi-Ngema Zuma Foundation. I believe that this was founded somewhere around 2010. What inspired you to to start this foundation?
Well, the foundation was established in 2010. I come from a family that is highly affected by diabetes.
Right.
I am not diabetic.
Okay.
Many people spread that word. I'm not diabetic, but my mother was diabetic. My aunt from my paternal side was diabetic. So I grew up knowing people that had diabetes, but I had never come across like a platform where I hear people talking about it. So it has always been my wish to start a conversation about diabetes.
Yeah.
So when the time arose, when I came to the spousal a support office where I had to do something to support the president in the community development projects. Then
Right.
I chose to do diabetes as my field of expertise, where I go out to the public and do something.
All right.
Then that was the perfect time for me to do something and break the silence about diabetes.
All right. Okay.
Yes. So it has always been my passion to say something about it, to break the silence, especially after observing how my mother kept it at bay and continued with her life, doing everything that the doctors told her to do with little or no information about the disease itself.
But I mean, is it your experience, or is it just perception that there's poor awareness around diabetes out there?
There is very little awareness about diabetes.
Right.
I wish people were as much informed about diabetes as they are about HIV and AIDS, because there are so many myths around diabetes.
Yeah.
People are scared when they are diagnosed with diabetes. They think once you are told you are diabetic, you are going to be amputated the next day.
Yeah.
So there is fear around diabetes, yet you can live positively with diabetes. So I thought when I share my mother's story, that you can live a positive life with diabetes. If she could live up 28 years with diabetes, though she went through all the complications, but she lived positively with diabetes and managed to keep it at bay. So I thought sharing that story with many people will give hope that you can live positively with diabetes if you follow what you're told. Take your medication, exercise, change, modify your lifestyle, eat correctly.
All right. Well, I mean, very positive messages. I mean, the WHO obviously has called on global action, to combat this dreaded disease, diabetes. Just give us a glimpse of what the foundation does in that regard.
Our wish is to see no one dying due to lack of awareness about diabetes. Hence, we have programs that we run throughout the year. Our primary target audience is people that are in rural areas, peri-urban areas, where information scarcely reach. So we have programs that are targeted to people that you cannot reach through internet. So we go out and reach out to those people with programs where we come and have a day where we educate, where we screen, where we promote exercise and say you don't need to subscribe to a gym, you can walk. So we physically go there and have a 5-kilometer walk with the community and say we come back, we screen so that when we leave, people know where they stand. But we don't only bring diabetes alone because it doesn't exist in isolation. So when we go there, we maximize the benefit of the day. We invite other NGOs that maybe do HIV and AIDS counseling and testing. We do TB, and so we come with a full pack of whatever health promotion that we can bring. And we partner with various stakeholders like the Department of Health, other NGOs that bring other,
Yeah. Well, talk about the Department of Health.
Then we talk about diabetes.
Yeah. I believe that recently you partnered with the KZN Department of Health and conducted a massive education, awareness and screening event. Tell us about that.
Well, we had one planned that we have postponed for World Health Day, which was a big one that we had planned for the 7th of April, which is World Health Day. But due to unforeseen circumstances, that had to be halted. That was going to happen in Shallcross in KZN. We are still going to conduct that one. But recently, on the 30th of March, we partnered with the Prince Msheni Memorial Hospital, where we celebrated the World TB Day. It is actually on the 26th of March, but we celebrated it on the 30th. You may know that people with diabetes are more susceptible to other infectious diseases like TB. And most people now, World Health Organization has prescribed that everyone living with diabetes must be screened for TB
as well.
And likewise, people with TB must be screened for diabetes. So we partner with people that promote TB awareness.
All right.
Hence
Lastly,
our partnership with Prince Msheni.
In my introduction, I mentioned that you were invited recently by at the Jarvis Christian College in Texas to speak about your work. Tell us a little bit about that.
Well, I think diabetes has exposed me to many platforms that I would not have reached. Yes, I was invited by Jarvis Christian College and Wiley College in Texas to give a lecture during their Black History Month on diabetes and also about history of the black liberation. So there's a lot of commonalities between Americans and in terms of our liberation movements and where we come from. But also what we share commonly, because you know the escalation of diabetes amongst black Americans and us here, where we come from and all of that. But that's where we are. I think coming from World Diabetes Congress, where also I was a speaker in the one of the platforms there, it attracted a lot. And there, diabetes is their major problem, more than HIV and AIDS.
Well, it is a major problem across the world, isn't it? So, well, Madam Bongi-Ngema, thank you so much for your contribution, and I wish you all the best in the lovely work, very important work that you do as the foundation. All right.
Thank you very much.
And we're going to put up some, if you want to find, know a little bit more about what the foundation does, there's the contact details on the screen, Johannesburg 011-056-4179, or simply just visit them at their website. Okay, well, we're going to go for a short commercial break. After the break, we'll now look at nutrition and the association between obesity and diabetes. Please stay with us.
Tonight in an SABC exclusive news expose, we show you how firearm proficiency certificates are fraudulently sold for a few thousand rand.
What you did was illegal. Do you at least acknowledge that? What you did is illegal.
I say it could be probably illegal.
Nigeria is Africa's second largest tomato producer.
The chief executive of Enrisco says he started the company with a capital of $75 million.
The problem now is that the market has been created in China.
He says that doing business in the country is becoming more difficult every day.
More than 2 in 3 adults are obese. More than 1 in 20 adults are considered to have extreme obesity. About 1/3 of children and adolescents aged between 6 and 19 are obese. Furthermore, 35% of adults over the age of 20 are obese. In 2010, overweight and obesity were estimated to cause 3.4 million deaths. South Africa has the highest overweight and obesity rate in sub-Saharan Africa, with up to 70% of women and 1/3 of men being classified to be overweight or obese. 40% of women in our country are obese, according to the Heart and Stroke Foundation. The bulk of our population used to be physically active, particularly in 1970 and 1999, and ate a diet high in fiber and indigenous vegetables, low in animal protein and refined carbs. However, due to the increased urbanization, people are adopting a more westernized diet, high in unhealthy fats, sugar and salts. Income and faster lifestyles have resulted in people consuming more fast foods and inconvenience foods. It is estimated that more than 30 million overweight or obese children live in developing countries, compared to 10 million in developed countries. According to the Heart and Stroke Foundation of South Africa, obesity has more than doubled since the 1980s. Childhood obesity is one of the most serious public health challenges of the 21st century. Overweight children are likely to become obese adults. They are more likely to develop diabetes and cardiovascular diseases at a younger age. these diseases are associated with a higher risk of premature deaths and disabilities. Globalization, improving economic conditions, and changing dietary habits in developing countries contribute to the rapid increase in obesity.
Quite a problem indeed. Okay, now let's learn a little bit more about nutrition and its association, at least the association between obesity and diabetes. And we still have with us Dr. Relebohile Ntsha, who's a public health medicine registrar based at the Charlotte Maxeke Hospital in Johannesburg, Wits University. And we have another personality living with type 1 diabetes, Romeo Malepe, and who runs an NGO called Swikiri. But before we talk to him, let's take a look at this.
When I found out I had diabetes, I honestly thought I was going to die. But the fact is, I didn't know anything about diabetes. All I knew was that it was a disease for older people. That's a lie. Actually, you can live longer with diabetes. The best thing to do is to educate yourself. Go see a doctor now. Don't hesitate. Don't procrastinate. Choose to live.
Choose to live, and we'll speak to him about that a little later. And then we have another guest, Ria Katsikas. Did I say that right?
Yes, absolutely.
Okay, Ria Katsikas is a dietitian in private practice based in Johannesburg from a company called Nutritional Solutions. Welcome to Health Talk.
Thank you for having me on the show.
All right. Let's come back to you, Dr. Ntsha. You know, we have this huge problem of obesity in the country. Perhaps let me ask you, how much of a problem is it? We hear that it's affecting more women and, more and more children are becoming more obese now. What is the extent of obesity in South Africa?
I mean, it's really growing, unfortunately. You know, we're having large numbers. Unfortunately, I can't give you the proper stats right now, but I mean, the numbers are increasing.
Yeah.
And we are seeing a lot of more women and children now being obese.
Yeah.
And it's really related to, urbanization, people living sedentary lifestyles, eating incorrect foods.
Yeah.
So we are really facing a huge problem in terms of
obesity. But let's
obesity.
come back to the association now between obesity and diabetes. Just now, you when you described two types of diabetes, you spoke about, either inefficient or people that don't produce insulin at all, or insulin that just is not, able to work or do what it's supposed to be doing. Now, how does obesity affect all of this?
So obesity is commonly found in type 2 diabetes. And the mechanism is that with the excess fat around the abdomen, the body or the body cells don't utilize insulin effectively. So then the thing is that it starts a cycle of then stimulating the pancreas to produce more insulin. And over time, the pancreas will now get tired of producing insulin and stop producing it completely.
Okay.
And then we get into then the process of diabetes.
But essentially what we're saying is that the more obese you are, the greater the risk of you developing diabetes.
Definitely.
And by the way, we're not only talking diabetes, there may be other conditions as well.
Yes, definitely. Because remember with diabetes, it's a part of what we call the metabolic syndrome, where we get all the other things like heart diseases, kidney diseases, all those diseases also contribute from diabetes.
Okay, let's get back to Romeo. Romeo, you say that you're living with type 1 diabetes and you choose to live.
Yes.
Tell us more about yourself and Swikiri.
Okay, I'm a type 1 diabetic, which means that my body does not make insulin at all, which means that I have to inject insulin. I have to put it in me. 4 years ago when I was diagnosed with diabetes, I didn't know anything about diabetes, and it actually took me back to when the people around me died, and everybody at home used to say, okay, so-and-so died, which is where, which is how this name came up. So I was quite depressed when I was diagnosed, and later on I just chose to find information, which was very difficult because it's also very difficult to understand the jargon around diabetes. You know, there's a lot of jargon, pancreas, insulin, ketones, beta cells, you know.
So what does Swikiri do then?
We took all of that and we simplified it. We are shooting a documentary. We're busy shooting a documentary right now. As you saw, we just shot a TV ad. We have a magazine, online magazine, which breaks down diabetes in the simplest way possible. You know, we got video interviews on the website. We got
so you're spreading the word. You know, more awareness about diabetes.
We're even creating an app right now as we speak that people are gonna use to track their blood sugar levels, meet other people who have diabetes. Around the world. You know, create a network.
Okay.
Yeah.
Ria, let's come back to you. I mean, great story, by the way, from Romeo. Just now we spoke about obesity, and you know, obviously it's related to nutrition, right? People out there watching the show would like to know now. Hang on a second. I don't want to be obese, and if I'm a little bit overweight, I'd like to lose a little bit of weight. Just help us.
Okay.
What should we be eating?
Okay, so all types of food provide us with a variety of nutrients and energy that we need in calories. In terms to control your blood sugar levels as well as your weight most optimally, there's three fundamental principles. I call them the TQ2 rule. T stands for the times that we eat, Q1 stands for the quality or the types of food we eat, and Q2 stands for the quantity or the amounts of food we eat. Now, in terms of times, 3 meals a day, and depending on your medication, your weight state, your appetite, you can snack, but we do warn people to be careful for grazing through the day, snacking inappropriately due to reasons other than hunger. In terms of the quality of food we eat, we're looking at carbohydrates, proteins, and fats. And your carbohydrates, that's all your foods from plant origin, control your blood sugar levels most significantly. We should choose carbohydrates that's unrefined, unprocessed, very high in fiber. Like
just give us an example there.
Corn, stump and beans, wild brown rice, rolled oats. And we should eat those foods to the expense of the white flour refined carbohydrates, like white rice and unfortunately pap and refined maize, white and brown bread, focaccia bread, ramazzinis, pizzas, prego rolls, shawarmas, bunny chows, fast foods, potato chips, fat cook. So these foods elicit a high glucose response and consequently increase your requirement for insulin. In terms of fats, we've heard that people with diabetes have a high risk for developing cardiovascular disease. And what research shows us now is that replacing your saturated fats, that's your animal fats, with unsaturated fats. These are fats from plant origin, like nuts, peanuts, avocado pear, oils. They reduce the LDL cholesterol, but they also have additional qualities in terms of inflammation, insulin sensitivity. They make actually the receptors on the cell lining more sensitive to insulin.
All right. Now, in practical terms now, for people that are saying, look, I see you have some models there, you know, to try and show us what a typical plate should look like.
So in terms of the quantities, you see, that's very, very important. We can eat the right foods. Now that vary from individual to individual, depending on weight, status, activity, age, gender. But the three basic rules that we can all sort of apply is to eat slow, to enjoy the food, to watch your portions, don't overeat on anything, don't have second portions, and then I've brought this plate model to show that for both meals, your lunch, your dinner, half the plate should be vegetables. Quarter of the plate should be whole grains, like beans and
lentils. Does it matter
what
vegetables?
Corn.
You know, they would say
no,
potato is a vegetable, so half the plate can be chips.
Yes, that's a good question. There's three vegetables that contain a higher carbohydrate content in most veggies, and those are corn and sweet potato and potato. And we sort of classify them in the starch group, and they will be then part of the whole grains. That will be a quarter of your plate. Your lean proteins will be a quarter of your plate. And then a minimum of 2 types of vegetables that you can stir fry, roast, soup, salads. You can really make it interesting and tasty with lots of herbs.
You know what,
spices.
because we've run out of time, where can people get information on what proper foods to eat and sort of, besides coming to expensive people like yourself?
You know what, there's the Diabetes Association of South Africa that can be contacted. There's also association, they call it the Center for Diabetes and Endocrinology. And then probably the best, we do dietitians, best choice is to see a dietitian, but our association also help people in terms of what they should do, and they should go to www.atsa, for the Association for Dietetic in South Africa. .org.za.
Okay, well, I'm afraid we're going to have to leave it there. Thank you very much. That's Ria Katsikas, dietitian from Nutritional Solutions. And of course, thank you very much to Romeo Malepe, living with type 1 diabetes. We're going to go for a quick commercial break. After the break, we'll learn more about the Cities Changing Diabetes project. Don't go anywhere.
Ephraim defied family and traditions to follow her dream.
Decided that I'm going to prove to them that they were wrong.
The first breakthrough came in when she was studying and touring in Europe.
That was my first breakthrough.
Generations was her first television debut in South Africa.
It was my first gig. I was very excited. I was very happy. I said, yeah, this is confirmation I'm at the right place.
After pain, rejection, and suffering, her dream became a reality.
I followed my path, and I'm happy, I'm grateful, I'm blessed.
Join your host, Buleng Mulabati, on Bupilong every Friday at 17:30.
Over half the world's population lives in cities. Every month, 5 million people move from the countryside to a city somewhere in the world. Cities shape how we eat, sleep, and live. And city lifestyles are leading to a disease that can be devastating, even life-threatening. It is an emergency in slow motion. We need cities that help us live healthier lives. Urban diabetes is not inevitable.
$2.1 billion people worldwide who are obese or overweight. That's 30% of the world's population.
Today, we are in a war against diabetes. Let's be very frank.
The problem is that we may created cities where the life is unhealthy.
It's all very nice to say what is wrong. I think there comes a time when also we have to find out as to what are we going to do about it.
How do we change this from a societal point of view, from a cultural point of view? How do we attack this problem?
We are trying to articulate a public health problem through the lens of diabetes. We're sort of beyond the point of that we need to do something. That is evident, but we're trying to get smarter around what we can do so it actually has an impact. And the complexity of the problem calls for solutions that take that into account. We're being more focused on the urban environment. We're being broader in how we view diabetes. And the intent and the hope is that that will give us some more clues on how to deal with diabetes on a global scale.
I think it's about taking a prevention lens, talking about how we can design our cities and our communities to really not only help people with diabetes, but help stop people develop diabetes in the first place.
Welcome back to Health Talk. Now, let's understand a little more about, physical inactivity, association of that, with diabetes and perhaps the Cities Changing Diabetes project. We still have with us Dr. Relebohile Ncha, who's a public health registrar based at Wits University, Charlotte Matlake Academic Hospital. And we're joined by another special guest, Flo Simba. Now, Flo is a professional boxer, former IBO World Youth Heavyweight Champion. Welcome to Health Talk, Flo.
Thank you for having me.
All right. And in our Cape Town studio, we're joined by Lloyd Leach. Lloyd is a biokineticist from the Department of Sport and Recreation and Exercise Science at the University of the Western Cape. Welcome to Health Talk, Lloyd.
Welcome to you, and thank you for inviting me.
Right. We're going to come back to you now. I believe we have a caller on the line, Mrs. Rahim from Johannesburg. Mrs. Rahim, welcome to Health Talk.
Good morning, sirs. Thank you for this program. I blame all the sicknesses, especially diabetes, for thyroid. My thyroid was not working properly, and I never knew that for so many years. And I think that when I used to pick up weight and all, but I used to go to the doctor, go for the test for my thyroid, but it was always okay. But then all of a sudden, now only I came to find out that it's my thyroid. And I blame thyroid for diabetes. Am I right? So if you can put a light on that?
Okay. If the line wasn't too great, but if I can take it, I think you're talking about the association between the thyroid gland and diabetes.
Yes, sir.
Doctor?
Well, with hypothyroidism, where really the thyroid is not releasing the hormones that it's supposed to, it leads to then obesity. And as we said earlier, obesity is a risk factor for diabetes.
Yeah.
So I think she does need to get a proper check, get a final diagnosis for her thyroid, and also just try and get into the modification of her lifestyle so that she can prevent then getting obese or getting overweight, and as a result of that, prevent herself from getting diabetes.
Okay. Whilst we have you, the Cities Changing Diabetes project, tell us a little bit about it, because we believe that Johannesburg has joined other cities of the world in this project. What is this about?
So Cities Changing Diabetes is a global initiative, and it's a partnership between Novo Nordisk with academic institutions as well as cities around the world.
Yeah.
Now currently they have 5 cities, but Johannesburg, city of Joburg, has now become the 6th, and is actually the first city in Africa to be part of this initiative. Their strategy is really to map out patients with diabetes. So we need to know who they are, where they live, what their social backgrounds are, so that we can then be able to generate, as we do our budgets, we cannot be able to have a set budget to manage those particular patients in those cities. And also is a platform where we can share information between cities and also come up with action plans or interventions to deal with diabetes. So ultimately the goal is to diagnose as many people as we can, put as many people as we can on treatment, and of those on treatment be optimally controlled, as well as reducing the number of people with complications.
Well, it's something that should be done everywhere. I mean,
yes, it should be.
It shouldn't really just be focused on cities. It should be
well,
everywhere.
I suppose that the link with urbanization,
Yeah.
and cities, because then that's where we get a large number of people who are obese, and we get high numbers of diabetes.
Yeah.
So focusing on those urban areas, and that the populations in those urban areas are quite high. But I'm sure eventually it will spread out to everybody.
All right. Well, let's get back to another special guest, Flo Simba. Now, Flo is a professional boxer. Flo, you've been living with type 1 diabetes for a very long time. Please tell us your story.
I was 16, turning 17. Lost a lot of weight in about 2 weeks, about 10 kilos. Thought I was dying. I spoke to my father. My father's a doctor. He says, no, it sounds like diabetes. And I went to the clinic, got checked, and it was diabetes. I actually thought I was dying. But the relief that I received when I found out it was just diabetes, then I realized, what, I've got another chance to succeed in life. And fortunate for myself, I started boxing.
So you started boxing after being diagnosed with type 1 diabetes?
Yes, after being diagnosed. Actually,
this is very interesting, yeah.
After high school, and what do you call it? I always thought to myself, I will beat you with diabetes.
Very
regardless.
Very profound, yeah.
And And it seemed to have prevailed 2 years later from an amateur career, 2 years, and I became professional and had quite a short amateur career, but a reasonable pro career.
Yeah.
And world champion, a few accolades here and there.
Right.
And I actually think to myself, listen, I beat you with diabetes. That's my concept.
So essentially you're saying you can live a normal life with diabetes. And in fact, we're stretching it a bit to say you can live a life of a professional. You can be hectically active to a level of being a professional boxer with type 1 diabetes. How does it affect your training, for instance?
Training-wise, it does affect you negatively,
Yeah.
but that's where you have to have willpower, basically. If you don't have willpower to push through it, because you know you got diabetes, you know what you're putting yourself through, you know all the conditions, all the strain you're putting your body through.
Yeah.
But you have to prevail and go through that.
Yeah.
You know, the muscle cramps, the laziness, you got to go through that. And
But overall, this is something that you live with, and it's part of you, and it doesn't hamper your professional life, as it were.
I wouldn't say it doesn't hamper, but I try not to make it hamper. If you make it like it's an obstruction to your goal,
yeah,
then you're making it a big object.
Okay.
I don't see it as an obstruction. I just see it as another challenge.
All right. Let's get across now to Cape Town and connect with our special guest, Lloyd Leach, a biokineticist based at the University of Western Cape. Now, Lloyd, just now we started chatting a little bit about, you know, the city's changing diabetes project, and I think the reality is that urbanization had a lot of, you know, negative effects, and one of those is that people have become inactive, and that has been associated with development of obesity and diabetes, of course. Now, how can we perhaps go through practical steps in which we can get people to become more active?
Well, I think the starting point is exercise is going to make a difference to many people's lives with diabetes. But I think the caution that one has to bear in mind is that exercise is not safe for everyone. So especially if you have been diagnosed with diabetes and it does present a risk for such individuals, I think it's important to get proper medical clearance. So I think the first thing to do is to check with your doctor to make sure that it is safe for you to exercise and it doesn't present a possible risk for you in exercise. And then from there is putting in place proper measures when you do exercise. So we saw in the case of Mr. Simba, who was able to establish a world record in terms of boxing, that it is still possible to perform exercise at a very high level, despite being diagnosed with diabetes.
Yeah.
So I think the first point is to make sure that exercise is safe for you, and then having done that, is to then look at the precautions you will take before, during, and after exercise. So I think the starting point is before one exercises, it's important that you look at preventing any complications, and this will be related to your blood sugar levels. So I think before starting exercise, it's good to just do a blood test to check what is your blood glucose levels. If it's too low or too high, then one needs to act accordingly.
Yeah. Now I mean, obviously that relates to people with diabetes. For the general public out there, people who don't want to, you know, who may be at risk of developing diabetes, perhaps a little bit overweight or not overweight as such, or a bit at risk of developing diabetes, what sort of exercises can they do? I mean, they don't have to go up and do professional boxing, for instance. What can they do? What are the practical things that people can do to be active?
Okay, so the general guidelines for the adult population in general, I think there's fairly good literature out there. It's if you just want to follow a normal, healthy lifestyle. I think there's a few areas that one wants to concentrate on, just from a health point of view. So the important starting point is, let's look at establishing a good body weight. And one of the basic measures of good body weight is a body mass index. Looks at the relationship between your height and weight.
Yeah.
So if you fall into a normal BMI category, it indicates that your weight is suitable for your height. And it's simple measures in that one can do to look at establishing what is a suitable weight for your height. For example, if you take someone like me, I'm 165 meters tall.
Yeah.
And if I simply subtract 100 from my height, a reasonable body weight for me is about 65 kilograms.
Yes.
And that is something most people can do. So a very, very good starting point in terms of getting involved in exercise is looking at what is going to be the purpose of exercise. Should I use it then to reduce my weight, to gain weight if I'm too light, or to maintain my body weight? So that's a good starting point.
Okay.
And other things I want to look at is also, importantly, is my cardiovascular health. I want to make sure that I'm getting enough health benefits to keep my heart healthy for as long as possible.
Okay.
So a basic guideline is if...
Yeah. Lloyd, I hate to do this to you, but we've run out of time. I think that this calls for an entire show just on physical activity. That's Lloyd Leach, biokineticist based at the Department of Sports and Recreation, Exercise Science, University of the Western Cape. Thank you so much for your contribution. I'm sure we will get back to you. Time for a quick commercial break. When we return, we look at treatment and monitoring of diabetes. Please stay with us.
What kind of solutions are those, Sila? Let's be specific.
Our racism is a unique blend of racism because there's racism without racists.
And the mistake we made was to believe that simply because we had a constitution that said that everybody was equal, that everybody really was equal.
Can a party outwardly ban certain media houses, specifically during election manifestos?
I think the professor enjoys that neutral position of not having to be conflicted by ethical questions, of having to change the world. That is the position he gets paid to do there in the university.
Most of us understand that to be a threat of violence against journalists.
No, I mean, it was in a context, well, I'm trying to explain. Their time in South Africa is over. They must pack their bags and go wherever they came from.
Watch Media Monitor with me, Alicia Jali, Sundays at 9 a.m. only on the SABC News Channel.
Welcome back. Now, we're going to learn a little more about treatment and monitoring of diabetes. We'll still have Dr. Relebohile Ncha, Public Health Registrar based at Charlotte Maxeke Hospital, Wits University. And we're now joined by another special guest, Sister Razana Ali. Sister Razana Ali is no stranger to this show. She's a diabetic nurse educator from DESA and Project Hope. Welcome once more to Health Talk.
Thank you very much.
All right. Doc, perhaps let's start with you now in terms of treatment of diabetes. We know that there's two ways we can, look at it. We talk about medication and we talk about insulin. Mm-hmm. Take us through medication.
All right. So for the two types of diabetes, we use different medications. So for type 1, which is the one where insulin is not produced at all, we then give our patients insulin. So they need to inject themselves with insulin. And then for type 2, at the initial stages, we use oral tablets. And these types of tablets, either one, stimulate the pancreas to produce more insulin, and actually not all, assist the cells to absorb the glucose. Now, with type 2 diabetes, once they start on the oral tablets, chances are later on in life, they could actually be now converted to using insulin. So those are the two basic treatments that we have.
How easy is it to put people on insulin, especially the type 2s?
I mean, at the time when they take insulin is now really at the later stages. Yeah. And for them to now adapt from taking tablets to injecting themselves, it's a bit of a challenge. Yeah. But I mean, with proper education and proper training, they can be able to do it.
Well, talk about education, Sister Ali. I mean, that's what you do basically, isn't that so?
Yeah, that's our focus.
Yeah. Tell us about it. I mean, it must be difficult to put a youngster onto insulin, a youngster just diagnosed with type 1 diabetes. Share with us your challenges and how you overcome them.
So, there's actually not only the youngster. This is a family we need to consider. So you have to reach out to the family members because when the child is still very young, they're easy to adapt. but the parents are very difficult then to assist. So we manage the patients as well as the parents. So the education is about holistic, not only the child but also the parents, even other support structures around. We need to educate, we need to go through the whole process of why it happened, what's happened, and of course with type 1 diabetes to confirm to them that it was not their fault. Because a lot of parents believe that it was their fault that has actually caused the diabetes. So we need to rethink, we need to think about that, we need to tell them about that, we need to educate, and we need to get their feedback on what they need. Sometimes we also educate about our need. We want to tell them what everything is about, but we also need to find out what their need is and then give them the education that they want, because that also makes it a lot easier for them to accept and to manage.
Let's talk about monitoring now, the importance of monitoring and how people monitor and how to deal with some of the side effects.
So monitoring is important because that is the window into your world. In the event that you feel bad, have a low blood glucose, the only way you're going to know whether it's low or high is by testing, because some people have similar symptoms, whether it be high or low. So this is the way you can understand how your body is actually sort of educating itself and also teaching you about what it needs. So monitoring is important for people with type 1 diabetes, obviously more often and more frequently, but with type 2 diabetes it's also important because sometimes your body lies. The body tells you that you're feeling good, but unfortunately your blood glucose is high, so you're getting long-term complications.
We spoke about importance of monitoring. How about sticking to treatment?
Well, when it comes to, obviously compliance is very important, but why do you not comply? Because you don't know what it's about. So the education is key, not only about the diabetes, but what is the medication doing? Where does it work? How does it work? What's the side effects? And what can you do about what happens when you do have the side effects? And what is the next step to treatment? So for type 2 diabetes, it's more of a challenge because people believe that they only need to stay on tablets, like doctor said,
Razana Ali, Sister Razana Ali, diabetic nurse educator from DESA, Project Hope. Dr. Relebohile Ntsha, Public Health Medicine Registrar based at Charlotte Matlake Hospital, Johannesburg. Thank you for your time.
Thank you.
Well, I believe we have some tweets that have just come in, but unfortunately we have run out of time. We're very, very, very sorry about it. We'll read your tweets next time. It's on that note, unfortunately, that we come to the end of our show today. Please join us again next week on SABC News. A reminder to please continue to share your views and comments with us via Facebook page, SABC Health Talk, and follow us on Twitter at SABC Health Talk. Remember that you can watch a repeat of today's show on Tuesday morning at 5 a.m. I'm Dr. Sello Mudau. Thank you for watching Health Talk. Thank you for those calls, the tweets, and please, let's beat diabetes.